All right, welcome to Whatsup Doc. It's the Dr. Shah Show. I'm Rich Gilgallen with Dr. Shah, one of the most noted dentists in the Coachella Valley and really around the country and, frankly, around the world. Doctor, how you doing, brother?
Hey, Rich. Thank you for having me on the show.
It's a great pleasure to be part of this podcast because these issues are so vital and so important to people. If you don't have a smile, you are behind the eight ball in business, in relationships. It can be a devastating thing, and people live their whole lives with this keeping their mouth closed when the picture's taken, and you're here to say that, look, you don't have to live like that your whole entire life. Tell us about that.
Well, smile and the world will smile with you. It's a known saying. People have a lot more confidence when they have a better smile. They have a lot more opportunities at their careers. And as you say, they hide their photos. They go out. They don't go out to dinners, have a good time with their friends. They don't do sports. And those things, we have advanced quite a bit in this profession where we can address those things and improve people's quality of life, which subsequently can build up their self-confidence and give them a better prospect in commerce and their family.
And it's not just about the cosmetic effect. It's the health issues. When your teeth are bad, you don't eat right. You pass on food that you should be eating because it hurts and things of that nature. And so you went to college. What was it that put you in dentistry? What was it when you were a young guy? You're still a young guy, but when you were a little younger guy, why did you choose that area of expertise? You had many, I'm sure, options open to you at the time.
Because I wanted to do it my way. One of the industries that is not heavily regulated, like the hospitals and medical doctors and surgeons, is dentistry, where you can set up your own practice, schedule your time, your hours, and also have a family life and then raise a good family. Because you can excel at one thing, but when you kind of keep balance of everything, that's a much more pleasant, successful life that you can lead for yourself. So that profession particularly gave me that opportunity to have all of those things that I desired.
Well, take me back to that moment. Was there a moment where you said, you know what? Okay, I can be a hip doctor. I can be a brain surgeon. I can be a heart surgeon. I'm going to work in dentistry. We're here with the amazing Dr. Keanu Shah from his beautiful practice on El Paseo in Palm Desert, California. So, was there some moment where you thought, this is where I'm going to go with my career?
When I was an undergraduate, I would volunteer at the local hospital in Macomb, Illinois, and Western Illinois, and that's when you sort of decide which direction you kind of want to go with your pre-professional school studies. And I would volunteer at the local hospital and listen to these I wanted to be a cardiac surgeon originally, and I would sit down and listen to them and the life stories and the things that they're having going on at home, and the lack of attention they were giving to their families, and they were really into that's a wonderful thing.
Sure.
Doing a beautiful thing for society.
But it's very sacrificial kind of work.
Very sacrificial. And then at some point, I realized it wasn't for me. Going a different route was the thing that sparked me, actually, specifically with a discussion I had with a cardiac surgeon in the hospital, in the waiting room area. And since then, I sort of geared away from that scenario and went into dentistry. Amazing.
And one of the great things about the educational aspect, I mean, you're a Saluki. I didn't know you were Saluki. The Western Illinois Saluki you're proud of that education. I'm sure it's an amazing university.
All Illinois, undergrad and dental school, and yes, smaller class sizes, more interactions with the instructors, and they train you really, really well down there.
What is a Saluki?
There's a lot of definitions for that.
I think so. But you had, I'm always fascinated by the moment where somebody says, this is going to be my career. Now this is the direction I'm going to go in.
Yeah,
so that was basically you knew that you could help people directly and see the results of your work without sort of a life in the balance kind of a thing like a heart surgeon would have to do.
Correct. Heart surgeons tend to change people's lives. So do we, in different ways.
Yes.
And most of my patients over the years that I've done bigger cases on become friends, and you have other relationships with them. But to get back to the Saluki scenario, we're known for partying very well at the Southern
Salukis,
crowd.
yes.
Yes, certainly that. But ultimately, we change lives, and now I realize that the gratification that we get out of it, it's not just monetarily, but the patients, they pick up the mirror, and after you do like a full mod rehabilitation case, and you see their new smile, and they find this new founded confidence, and some of them start crying.
They weep.
Of them give you a hug. And
they weep.
Is probably the most gratifying feeling you can have as a doctor.
Isn't that something? I can see that, and I just hanging out with you just a little bit. I've seen your patients. There is this enormous feeling of goodwill, it seems, between you and the people who you have brought back almost to life in a public way, where they can't stop smiling. It seems like and it really is something to see. It's a very special relationship, I think, that someone like you has with your patients.
Yes, and that is because we build it the way we wanted to build it. Nowadays in America, you have all of these corporations popping up everywhere, where everyone is a number. Mm-hmm. There's no good relationship between people. Local businesses are being sort of taken out. But we need to get that back, because that was the core of our success around the world as Americans, is our small business operations.
Amen. Yes.
And you have a much better, more close relationships with your clients, be it patients, be it some other business type. So I did not want to do the corporate thing where I was running around between chairs, numbing patients up, and patients notice.
Right.
You get a whole different response even from patients when you spend half an hour, 45 minutes, and sit down with them, and just shoot the breeze and figure out what they want, what their problems are.
It's a good point. There's many, dental areas where you have the sense that you're just part of a factory line, where this one does this, then the dentist comes in, spends 3 minutes, 5 minutes, and then moves to the next. Somebody's yelling in the next chair, and then he comes back. He does like a circle. But you seem to focus on each individual client in a very special way.
Yes, the corporate model does not work in medicine. There's no one shoe fit all. You have to actually spend time with the patients. You have to understand what they want. So we have taken the patient-doctor relationship back to where it was when you went to your doctor and you had your doctor, and it wasn't a revolving door where every time you came in there was a different person there.
Right.
That patient-doctor relationship is sacred, and it should never be infringed upon by the corporate outfits. So it's very important to get to know the patient, sort of set expectations, manage expectations, and under-promise and over-deliver at the end of the day.
Well, what you have done is combine your education, the medical education, with your business education, because you extensively studied business as well, as I look at this amazing bio, by the way. And, so you don't need the corporate sort of business approach. As a businessman, you've developed your own approach to this business, and it's very exciting.
Yes, the professional schools, be it medicine, optometry, pharmacy, chiropractic, or down the line you go, they do not teach you any business, and if they do, it's a one-course ordeal where you don't really learn anything from. So these colleagues of mine come out of school with $300,000, $400,000, $500,000 in debt,
right? And
then they have limited choices, and they end up working for these corporations. We want to turn the tables where we enable doctors. So we started the hashtag Doctor to Doctor movement that you can see on Instagram, Facebook, LinkedIn, and all the others, where we enable doctors from every aspect of industry, from an administrative, financial, as well as an academic perspective. So they're self-sufficient, they're independent, they're free thinkers, and they can go out and succeed in the marketplace by deploying those skills that we teach them. Now, what started with 2-3 guys is now well covered over, I think, 84 countries are now involved in our educational products.
Unbelievable. 84 countries.
Yes, we started the world's top 100 doctors, which are strategically involved in the supply chain that are helping us in various endeavors. We started a school program where we teach business education to doctors. So 26 verticals are led by 26 different doctors, which essentially get help from another 500 doctors or so, and it's ever growing. This year we're taking on another 500 doctors that are coming in into our operations. But the goal is very clear. Our mission and vision is to empower healthcare professionals. Because when you empower healthcare professionals,
yes,
and you remove all these third parties out of the equation,
yes,
then that's when healthcare prices go down, patients get better care.
Right.
Everybody has their hands in the healthcare industry.
It's so the whole sort of conflagration of government and these other pressures that are put on businessmen who happen to be in the healthcare industry, and you have addressed that in a way that nobody really had before. So this is cutting edge kind of stuff that you guys have been working on.
Yeah, it's a very sad story. You have insurance companies now clocking in $220 billion, and you know who you are. And you have problems in our healthcare system, in the hospitals, and it's absurd. These profits do not need to exist. Insurance is right now. We have a commission. We have a HEX commission from different medical industries that come together, and we realize that patients go to the doctor, and the first thing they ask is, "Does my insurance cover this?"
Yes.
That's not how healthcare should be.
Amen, brother. You're hitting the nail right on the head here. Absolutely.
These guys started in the back of a grocery store without any fraternity to healthcare or medicine whatsoever. Now they're dictating to us what they would pay for, and they kind of got us.
Yeah.
And now the patients are coming in, and treatment should be rendered by the clinician. The treatment plan should be rendered by the clinician, devoid of any third-party influence. It's a contract between you and the patient to care for the patient in the best interest of the patient.
Well, I couldn't say that any better if I tried. That's Dr. Keanu Shah, who is here from Desert Dream Dentistry. And you can look up their website. It's an amazing website, desertdreamdentist.com. And the phone number is 760-219-7487. And what we're trying to tell you here, folks, it's very simple. If, you're hiding your teeth, you don't want people to see you smile, you're looking the other way when the camera goes on. I know the feeling. I know that feeling. It's a horrible feeling. When I was a kid, I had a horrible cap that some guy put on. It turned different colors. It was a nightmare. There's not one single picture of me smiling in high school. Not one. I keep my mouth shut, and so, when you have that smile back, that's the joy, and it penetrates your soul. It seems to me,
changes your life. Your mouth is essentially, not besides the smile. You also mentioned something about health.
Yes,
that's your. After your skin, it's sort of your first line of defense into your body. And what happens is it's known as the dirtiest organ in the mouth because you have so many different bacteria that are in your oral cavity.
Sure.
And some of them are opportunistic. So when they find the right environment, they come in and attack.
Right.
So, and your mouth is connected to vast majority of your organs in your body. So a lot of other health problems I have patients all the time that as soon as they get, for example, an infection resolved in their mouth, they stop feeling lethargic and tired all the time,
mm-hmm.
and then they feel better, they sleep better. We make appliances for people that don't like their CPAP machine. That opens their airway, gives them more energy. Small changes in your oral cavity can have a profound impact to your overall health.
Very well said. Again, Dr. Keanu Shah. Now, you mentioned in the same vein with the health, actually can affect your heart, and as you point out, enzymes. when your teeth are bad, your whole really world is bad. It seems to me, but people are reticent to go to a dentist because they're afraid to go to the dentist. Your office, having been there, and I'm one of those people. Okay, I'll be honest. I was as a kid. I think just had a terrible a child dentist, and it just put me off on the whole thing. And people will actually suffer with oral pain and embarrassment, and instead of just making a call and getting a consultation. It doesn't hurt to get a consultation, and you offer that service, do you not?
Yes, and you're very correct. I hear these stories quite often, and that childhood experience stays with you for the rest of your life, most of the time. So the patients that come in apprehensive have these situations, but part of our consultation, part of us sitting down and getting to know them, is to build trust in the clinician. Because if there's no trust after the consultation, they may be better served by someone that they do trust. But trust is the key factor. And then once they come in, you don't go right into doing a bunch of work on them,
right,
scaring the patient even more. You got to take phases. But everybody's different. I have managed to sit down and have a candid discussion with them, go over every step, like we do with children. We show them instruments. We tell them about bugs of different colors in their teeth and what have you. There's the same psychological way of actually accommodating the patient and getting down the level. When you don't talk to patients like you're a doctor and you're above the patient of some kind, and you get on the same level and find commonalities, you start having a dialogue. And then that dialogue leads into the questions and concerns that they have. Then you address those concerns and questions. And then you start small, and then you continue building up, and then you get their work done. And for this community here, being mostly geriatric patients and retirees, it's even more important.
Of course,
because they have heart problems, they have kidney problems. Right. When the bacteria leaks into your bloodstream from your mouth and goes to those areas, it's a life-threatening situation at times.
Yes.
Bacterial endocarditis, countless other situations we have with knees and joints and what have you. So it's very important that they keep up with their regular appointments. A lot of them have dentures, and they don't come in. They say, okay, well, I don't need to go in. I have dentures. And then after a couple of years, it recedes and they're loose, and then they come in and they're surprised that the options are limited and we have to do adjustments. So it's still important, even if you're out of the system, that you get back into the system and visit with your oral health care provider.
Well, let's talk dentures for a second here. With this is Rich Gilgallen along with Dr. Keanu Shah from AmazingDesertDreamDentists.com. Check out that website. The phone number is 760-219-7487. Now, a lot of people have this vision of dentures from their grandparents, when they were in the 60s or in the 1950s. When, how far has the science come on this denture situation? I mean, it's not like it was 100 years ago.
No, we have a lot of options now. We have dentures that are completely fixed in your mouth that only the dentist can take out with implants, and then there are dentures that snap on to like these little balls. There are many different options we have now to accommodate. Those days are long gone.
Yes.
Back in the day, you patient.
They had the dentures on the shelf, and they just pick a pair. Okay, that looks good. Let's grab those. Those days are over. You have an amazing scientific approach. You have a
CT machine.
The CT machine, a CAT scan of the mouth. So these are so precise. And as you point out, over a period of time, adjustments have to be made. But initially, it's not like the old days. And I think people really need to grasp that there is new science, and they look better. But it's not just cosmetic. They feel better than your grandmother's dentures. That's what I'm trying to get across. Is that a fair statement?
Yes, if you have the right tools. I think Jesus was a carpenter.
Yes.
If you have the right tools, you can do a better job, right?
Yes.
So with a CT machine, we can now actually look at three-dimensional scenarios of your mouth and your head and look for any kind of abnormalities.
Sure.
And also measure the height and width of your bone and kind of know exactly where we would place those implants. But people don't know. They see this marketing on TV that one implant costs $3,000 or $5,000.
Right.
Then they're thinking to themselves, "Oh, I have
It's $50,000 in my teeth."
No, you can have 4 implants. You can have 12 teeth on 4 implants.
Right.
There's a lot of ways we can do it, depending on your circumstances. But having the right tools, I've always been a fan of going digital,
Sure.
and eliminating the need of all of this paper and these medical practices that are chopping trees down left and right.
So much paper in
So
the
much
medical
paper.
practices. Unbelievable. You're so right.
100% digital now.
100% digital.
We just acquired the latest 3D technology for impressions.
Yes.
And we are now taking our impressions without the GUI stuff often.
Yes.
We got to transition into it, but our impressions are going in. Dr. Masi came in from Loma Linda to join our
Yes,
practice.
Dr. Masi has just joined Dr. Shah. That's a powerful 1-2 punch over there.
Yes, we are bouncing off each other. I learn stuff from him. He learns stuff from me. He's the digital 3D impressions expert.
Is he?
He's been using it for years at the university and has been teaching on it. So it's a very convenient situation. He's scanning now the crowns and those type of things, and some dentures we can scan now. Not full dentures yet, but partial dentures we can scan now.
Well, one of the things you've focused on in your education and your awards over the last several years is for your work in the extraction part of this, which is, in order to get to the proper place where the implants or dentures are available, in many cases, in fact, in almost every case, there are extractions that have to take place. And that's been a focus of your work, to mitigate the pain and the agita, the sort of nervousness that people have about that. Can you touch on that just for a second?
So I started 3 different academies. The first one was the International Extraction Academy. For the past 7 years, we've been holding workshops and teaching other doctors how to do extraction. The philosophies have changed. Back in the day, you would go to the dentist, he'd take a tool to it, and
believe me, they
break
put
it up.
one foot on your on the chair and the pliers and
It was a barber. It was a barber.
It really was a barber.
It was a barber shop
Yes.
before where you got that done. And now you actually have to preserve the bone 360 degrees in order to be able to put a nice implant in. Or you have problems. You have to bone graft and do other things. So atraumatic extractions are extremely important.
Yes.
I've been teaching it for 7 years with my with the head of the oral surgery and implantology division at New York University. He's been with me for
Now, what was that?
all this time.
Atraumatic extraction.
Atraumatic. You got to. I mean, it's a word that we use.
Yes.
Minimally invasive is probably a little bit more accurate.
Well, atraumatic, I think we can grasp that. It means it's not traumatic. Is the and it's the thing I think that scares people sometimes. And you're here to tell them, hey, you don't have to be afraid of that.
I get that all the time, especially the apprehensive patients that come in.
Yes.
They're all worried, and after the appointment, they're like, wow, that was nothing. And then they go, and then I'm like, you remember you're almost running out of my chair?
Yes.
When I picked up the needle?
Yes.
Now you're, and there's techniques you can do with the needles. I have mastered a technique where I go in, and I put the topical on, get it a little numb in the area, then I put a little drop in, and then I wait. And that drop takes effect, so when you give them the actual shot, they don't feel it.
They don't feel it.
They don't feel the pressure, because the pressure is what hurts. The pressure of that fluid building up in your gums.
Right.
That's what gets you, and that's what that pain is all about.
Well, you see, you've taken the time to study this. This is why, this is what I mean when I say we've come a long way, baby, in the dental industry. Because in the 40, 50 years ago, they didn't care, okay, if it hurts. They would, if it was time to take a tooth, they're going to pull the tooth. They might, Novocaine, of course, was everything in those days.
Now you have to, by standards of care, you have to think about what's going to happen after. If I just yank this thing out and I take a bunch of bone with me, then I don't have anything to put there later. So you have to think about the future, and that is best done by skilled individuals. I've done easily over 30,000 cases.
30,000 extractions.
On wisdom teeth, yeah.
On wisdom teeth, which is the most difficult one, I'm guessing,
yes,
right?
Because
they're impacted and And that's a nightmare when you have that, because you're in constant pain until they see you then.
Yes.
They come running to you when that happens, okay?
Yes, so the wisdom teeth, they can create a lot of problems. They often push on teeth. They cause cavities behind the second molars. Then you can't restore the second molars, which is a very sad scenario. You have to take both of them out. But every dentist is better at something. For me, it was always surgery. I loved it. It's a good practice for me. That's my core competency. So every dentist has a different skills, and there are specialists out there. I refer when I can't do a case or when I think it's a little bit out of my wheelhouse, but that's rare. So we do just about everything in-house, have for over a decade.
Well, what a pleasure to have the opportunity to talk to you about these issues. By the way, it should be pointed out that Dr. Shah has been on the cover of more medical magazines here in the Coachella Valley. Was selected as the number? Go ahead.
It was a 2020. There's a Top Doctor magazine 2020 Dentist of the Year.
Dentist of the Year, I'm talking to right here. Okay, this is not small potatoes we're talking to here, and I know exactly why. You go into his office and you'll know why. You can feel a sense of peace. There's a somewhat of a Zen feel to it with your staff, who are so wonderful, and you can tell. I know you're very close to some members of
You're
your
like
staff.
a little family. It's like The Simpsons when you go to the office.
And I've always enjoyed dealing with businesses where, office manager and doctor know each other well. Okay.
It's also very important. We care for each other in the office as well.
Yes.
Creates a family feel. There's sometimes bickering going on. The patients find
Sure.
it to be amusing.
Sure.
But we don't hold back. We are just having a
Honey,
good time.
you left the cereal bowl on the counter again. So
Actually,
no.
I think the patients enjoy it.
They do
There's a
enjoy
lot
it.
of back and forth fun going on.
Well, this is very exciting. Look, I'm going to tell you this. You got some issues, okay? And you're afraid to take care of it. You're nervous. Don't feel like you're the only person, the Lone Ranger, that feels that way. Before you do anything else, you want to check out desertdreamdentist.com, and you want to call 760-219-7487 before you do anything else. And take care of this. You don't have to suffer with pain or with embarrassment anymore in your life. You worked your whole life. If you're a Coachella Valley resident, chances are you worked your whole life to be able to live here and to enjoy these years of your life. Don't hide in the in the basement because you don't have a good smile.
Things change. You get your hobbies back. You're out playing tennis. You have to run into the bathroom and clean your dentures half the time.
Exactly.
At a dinner that.
Oh, you don't have to take them out to have a sandwich and then put them back in when nobody's looking. I mean, come on. Don't live like that anymore. Check out this wonderful addition to the Coachella Valley. He's been here for a while. He is a very special guy, and he's got an amazing practice that people return to over and over and over again because of his personality.
Yes, and I think what you guys are doing here is a great thing. This Whatsup Doc.
Whatsup Doc, the Dr. Shah show right here.
It will help patients that have questions that they don't know. People just don't know what they don't know. So they don't know what they don't know. So if they have the opportunity to call out to you and bring up topics,
yes,
things that they want to know about, this is very helpful for the community to have this show, and actually the whole country, where we can bring this information to them on their drive to work or wherever else.
And this broadcast will be available on the websites. It'll be available all around. We appreciate you so much coming in, Doctor. You are DesertDreamDentistry.com. I'm sorry. I wrote it that way and I can't read it. So it's DesertDreamDentistry.com. That's dentistry.com. And check out Dr. Shah, Dr. Keanu Shah Saluki. He's a good man, and he's got a beautiful office. And tell him the coach sent you when you get down there, because it's a great community, and as you pointed out, it's got a family feel to it. Thanks for coming by, brother.
Thank you so much for having me.
All right, we'll do it again. We're going to do this.
forward to
We're going to do it once a month. We're going to do the Dr. Shah show, the Whatsup Doc show. All right. Thanks for coming by there, brother.
Hey, thanks.